It is my great pleasure to introduce today's speaker, Nada Abu Ghazaleh. In 2006, Nada started her undergraduate in biomedical engineering at Hashmat University in Jordan. In her college, she worked on a cell-based therapy for orthopedic application, specifically using mesenchymal stem cells. After she received a Bachelor of Science degree in 2010, she came here to the University of Calgary to start a master's course in biomedical engineering under the supervision of Dr. Walter Herzog. Her thesis for the master's topic was about how the knee joint is affected by concentric and eccentric exercise by quantifying chondrocyte, that's the cell death, and changes in synovial fluid protein using a rabbit model. Her work got an attention and acknowledged by receiving biomedical engineering outstanding performance award. In last year, 2020, she started her PhD under the same supervisor, and now she's been working on developing new dietary and exercise intervention strategies to prevent obesity and associated osteoarthritis in the knee joints. Aside from academic career, she introduced herself as a mother of the 2 active boys, spending most of her free time to catch up with them. Nada also mentioned that she loves cooking as much as she actually wanted to become a professional chef until she found herself more interested in research and graduate studies. Today she'll be talking about 2 studies that she did recently, starting with the effect of oligofructose fiber supplementation on knee osteoarthritis progression in obese rats. All yours, Nada.
Thank you so much, Sangwan, for the nice introduction. First, I would like to apologize. I had technical problems. So my name is Mahmoud and Omar. These are my kids. So I had to use their laptop. So I'm sorry about that.
I think now you can share your screen.
Yeah. Can you see my screen?
Yes. If you go, yes, now I can see your screen and I hear you well.
Thank you. Okay. So my presentation will be divided into 2 parts. The first part, I'll be talking about part of my PhD project, where I'll be talking about the effect of oligofructose fiber supplementation on knee osteoarthritis progression in obese rats. Basically, I'll be focusing about the background of my project, the method that we'll be using to test the hypothesis, and the preliminary results we got so far. In the second part, I'll be talking about a study that I've been working on with some colleagues from our group. It focused on trying to identify the effect of different types of exercise on knee joint damage. I'll be talking about the motivation for this study, the exercise detailed information about the exercise intervention, and the results we got. So starting with the first part, osteoarthritis is the most common joint disorder affecting multiple joints, such as hip, knee, fingers, and spine. It affects around 300 million individuals worldwide. It is associated with breakdown of articular cartilage, thickening of the subcondylar bone plate, inflammation of the synovium, and muscle atrophy. These symptoms are associated with pain, stiffness, and disability that affect patients' mobility and the ability to do simple activity of everyday life. There are lots of risk factors that increase the chance of developing OA, such as aging, trauma, genetics, sex and race, and obesity. In my project, I'll be focusing about obesity and inflammation and the associated metabolic syndrome as the main risk factor of developing OA. According to that, OA can be classified into many phenotypes according to the etiology of the disease. In this project, we'll be focusing about metabolic OA that includes obesity, metabolic syndrome, and inflammation. So obesity has been linked to OA through excessive joint loading that exceed physiological range, and that results in joint degeneration in weight-bearing joints. However, OA in individuals without obesity has been found at a great rate in non-weight-bearing joints, such as the fingers. This suggests that there is another mechanism in which obesity affects and the onset and progression of OA. In 2009, it was stated that metabolic syndrome, which is a cluster of different metabolic abnormalities, such as insulin resistance, hypertension, obesity, and dyslipidemia. It was stated that metabolic syndrome was prevalent in around 60% of OA population and around 23% of the population without OA. Now, it is well established that inflammation and the associated obesity and metabolic syndrome has a crucial role in developing OA and starting at the onset of it. So before I start talking about the source of inflammation in metabolic syndrome, I should be introducing the latest superorganism in human body that is called the microbiota. It is defined as the population of microorganisms that resides in the gastrointestinal tract. This includes fungi, bacteria, viruses, and other organelles. They have an essential role in maintaining immune and metabolic homeostasis and protecting the body against pathogens. In a healthy gut, there is a balance between what is called good bacteria that has a beneficial effect for the body and the bad bacteria. The imbalance or dysbiosis between these two types of bacteria cause a serious health problem. So it has been suggested that the dysbiosis in the gut microbiota is one of the main source inflammation in metabolic OA. This is a graph showing a healthy gut where the epithelial cells are separated from the gut microbiota by a mucus layer. The gut microbiota, the good bacteria, produce short-chain fatty acid that maintain the tight junction between epithelial cells and prevent any leak for the gut microbiota itself and its byproduct to the system. However, consuming Western type diet that is high in fat, high in sugar, low in fiber, which is the main source of food for these guts microbiota, cause decrease of production of short-chain fatty acid and cause these gut microbiota to feed in the mucus layer, separating the gut microbiota from the epithelial cells. This also leads to weakening the tight junction between epithelial cells and moving the byproduct and the gut microbiota itself from the intestinal tract to the system. This phenomenon is referred as leaky gut, which is believed to have to be the main source of low chronic systemic inflammation associated with obesity. So the second source of inflammation is enlarged adipocytes or adipose tissue in obese people. So enlarged adipose tissue are have higher macrophages infiltration that acts as endocrine organ producing pro-inflammatory cytokines, such as interleukin-6 and TNF-alpha. Also in obese people, they have a high level of free fatty acids circulating in the system. Both the pro-inflammatory cytokines, the free fatty acids circulating in the system cause dyslipidemia, insulin resistant, and as a result, increased low chronic systemic inflammation associated with obesity. So to summarize, there are two main sources of inflammation associated or suggested to be in metabolic OA. The first one is dysbiosis in the gut microbiota, which is more bad bacteria compared to good bacteria that cause systemic inflammation. The other source is enlarged adipocytes, especially visceral obesity that surrounds the organs, the internal organs. They act as endocrine organs, producing pro-inflammatory cytokines, as well as increased mechanical stress in weight-bearing joints. Altogether, they increase the prevalence of metabolic syndrome, which means increased insulin resistance, hypertension, dyslipidemia, and as a result, metabolic OA. Recently, many interventions have been proposed to decrease the effect of inflammation associated with obesity. In our lab, Rios ATL has showed that exercise, fiber, and the combination of exercise and fiber fully protect the knee joint from a degenerating effect resulted from consuming a high-fat sucrose diet when introduced at the same times of consuming the high-fat sucrose diet. So this is an image taken from her paper. This is part of a knee joint taken from rats consuming a chow normal diet. This thin red line represents the cartilage in the femur and the tibia. This is the meniscus, and this is the subcondylar bone and the bone marrow. She reported in the paper that consuming a high-fat saccharose significantly increased joint damage, as you can see here. So the cartilage almost completely sunk into the subcondylar bone, and you can see that there is a tear in the meniscus and big cyst in the subcondylar bone. This degenerating effect has been observed in rats consuming a high-fat saccharose without any kind of intervention. However, when exercise, fiber, and a combination of exercise and fiber was introduced at the same time of starting consuming the high-fat saccharose in rat, they were able to protect the knee joint from the damage associated with consuming the high-fat saccharose diet. A year later, the same group reported that these same interventions were unable to prevent knee joint onset and progression when introduced after 12 weeks of starting the high-fat saccharose diet. These two results gave us the idea of the project, that there is a critical time window where the intervention should be introduced, where they will have a protective and good effect against the degeneration effect of the high-fat saccharose diet. According to that, the objective of my study is to determine the specific time window for prebiotic and exercise to be introduced to rescue the joint and reverse metabolic syndrome. We also want to identify the mechanistic link between obesity, gut microbiota changes, and the associated low-grade chronic inflammation with muscle and joint degeneration. We hypothesize that there is a critical time window following obesity induction when a prebiotic fiber, exercise, or a combination of these two interventions will be successful in preventing knee OA or knee joint damage in rats. Beyond this critical time, fiber cannot reverse the obesity effect, and exercise can be detrimental and accelerate knee OA development. So to test our hypothesis, we will be working on three separate projects. The first one will have 12-week-old Sprague-Dowley rats randomized into 5 separate groups. So the first group will consume a controlled normal chow diet for 12 weeks. The second group will consume high-fat, high-sucrose diet for also 12 weeks. The other 3 groups will have an intervention introduced to them after 3 weeks of starting the high-fat sucrose diet. So the first group will have a fiber supplementation given to them after 3 weeks of starting the high-fat sucrose diet. The second group will have an aerobic exercise, and the third group will have a combination of aerobic exercise and fiber. So the fiber supplementation we're using here are specifically oligofructose fiber. All these groups will be sacrificed when the rats are 24 weeks old. Joints, different joints, muscles, blood, and other tissue will be collected and assessed. So far, we were able to do the first 3 groups, which is the chow, the high-fat sucrose, and the high-fat sucrose with the fiber supplementation, and I'll be presenting some preliminary results related to these 3 groups. If this 3 weeks delay in introducing the intervention were successful in preventing knee joint degeneration in rats, the second project will be done, which will have the same 5 groups and same age of the rat, but the intervention will be introduced after 6 weeks of starting the high-fat sucrose diet. Same type of intervention, fiber supplementation, aerobic exercise, and a combination of 2. Same thing, all rats will be sacrificed when they are 24 weeks old. Again, if the result we got from this study showed that the 6-week delay were able to rescue the joint and prevent the degeneration effect of the high-fat sucrose diet, the third project will be done. Same thing, we'll have the same 5 group. However, the intervention will be introduced after a 9-week of starting the high-fat sucrose diet. Same interventions, and all rats will be sacrificed at 24 weeks. So far, we started with the first project with the delay of the intervention be 3 weeks, and we got so far preliminary result of the first 3 groups. So here I'll be presenting the body mass during the experimental period for the chow or control group for rats consuming a high-fat sucrose diet and rats consuming a high-fat sucrose diet with fiber. So this blue line represents the increase of body mass, the mean increase in body mass during the 12 weeks of the intervention for the high-fat sucrose diet. group. So I'll be referring at the group who consume high-fat sucrose diet without any kind of intervention as a high-fat sucrose group. The orange line will represent rats consuming high-fat sucrose diet with a fiber supplementation. And the gray line represents the mean body mass for rats consuming normal chow diet, which will serve as a control group. After 3 weeks of starting the high-fat sucrose diet, we found a significant increase in body weight, in body mass in the high-fat sucrose group and in the fiber group compared to the chow group. This indicates that obesity has been induced in this animal obesity model. After 12 weeks of starting the high-fat sucrose diet, we found that the body mass was significantly higher in the high-fat sucrose group compared to chow. What's interesting is that we also found that the body mass for the high-fat sucrose group were significantly higher compared to the fiber group, which may indicate that the fiber group, the fiber supplementation had an effect on decreasing the pronounced increase in body mass. To assess one of the parameters in the metabolic syndrome, which is insulin resistance, we looked at we did an oral gavage tolerance test, which is a test used to see the how fast or how good the body can metabolize the glucose in the blood. So this was done by fasting the rat for 16 hours and then giving the rats a glucose solution and measure plasma glucose at different time points. The first time point will be 0, where before they were taking the glucose solution. And after 15 minutes, 30 minutes, 60 minutes, and 2 hours. Typically what we expected to see in a control group that the plasma glucose will drop almost similar to the base value that we started with. However, as you can see in the blue line, which is the high-fat sucrose group, the plasma glucose remain almost very high compared to the control group, which is around 9 millimole per liter, which indicates that insulin sensitivity has been reduced and may also indicate the onset of insulin resistance. For the body composition, we looked at changes in percentage of mean body fat and mean lean mass using DEXA machine. So this is a graph showing the percentage of mean body fat at the end of the intervention after 12 weeks of starting the high-fat sucrose diet. So the blue bar represents the high-fat sucrose group, orange high-fat and fiber, and this is the chow or the control group. We found a significant increase in percentage of body fat in the fiber group and the high-fat sucrose group compared to the chow group. What was interesting that we also found a significant difference between the fiber group and the high-fat sucrose group. This also may indicate that the fiber supplementation was able to reduce the amount of body fat gained by consuming the high-fat sucrose diet. Looking at the lean mass, we found that the high-fat sucrose group or rats consuming the high-fat sucrose diet had significantly lower lean mass compared to the chow. This was not observed in the fiber group, which also indicates that the fiber group or the fiber supplementation has a beneficial effect in maintaining lean mass in rats consuming high-fat sucrose diet with the fiber. Currently, we're working on looking at the joint integrity and joint degeneration, which is the major outcome of my study, where joints has been collected, decalcified, stained, and currently are being reviewed and scored. According to the results we get from this joint integrity, we'll decide if we're going to do the next 2 groups and go to the next project. Of course, we'll be also looking at other outcomes, such as changes in gut microbiota and inflammatory biomarkers in blood and synovial fluid. We'll also be looking at muscle integrity, which is looking at different fat infiltration in different types of muscles such as VL and soleus, and also at collagen content. So the significance of this study, we think that this study will give us an insight into the relationship between obesity, metabolic syndrome, and changes in gut microbiota and knee osteoarthritis. It will also enhance the understanding of obesity-associated musculoskeletal degeneration pathways in a well-established preclinical model of a high-fat sucrose diet-induced obesity. By that, I'll finish the first part of my presentation, and now I'll be talking about the second part, where we'll be assessing the effect of different type of exercise in knee joint damage. So this is the title of a paper that we're currently working on. We're in the final step of it. So the motivation of this study was a paper published by our group by Rios ATL in 2019, where she showed that aerobic exercise had a beneficial effect in protecting the joints from onset and progression of knee osteoarthritis. Sorry. So this is a graph taken from her paper, where, as you can see, this bar represents the rats consuming high-fat sucrose diet. This is the modified Mankin score. It is a way to represent the joint damage in rats. So with a higher modified Mankin score, the higher the joint damage. So she showed that aerobic exercise, like here, rats consumed high-fat sucrose diet and performing aerobic exercise has significantly lower modified Mankin and Orsi score compared to the high-fat sucrose. She also showed that rats performing aerobic exercise had lower serum triglyceride level compared to the high-fat sucrose group. And also she showed that aerobic exercise or rats performing aerobic exercise has significantly lower triglyceride to HDL ratio compared to the high-fat sucrose group. They reported in the paper that triglyceride level and serum triglyceride to HDL ratio are strongly related to modified Mankin score. So with the increased triglyceride and triglyceride to HDL ratio, we would expect a higher damage on the higher Mankin score in the knee joints. So this study raised the question, which is, is this beneficial effect only related to aerobic exercise, or other types of exercise such as resistant exercise will have the same beneficial effect and protect the joint from the effect of the high-fat sucrose diet? We also asked ourselves if the resistant exercise was able to protect the joints from the damage, which one is better, like performing aerobic exercise or resistant exercise? From that, the purpose of this study was to investigate the potential effect of a 12-week resistance exercise training program on a knee joint damage in an established rat model of a diet-induced metabolic obesity in knee OA. I will go to this slide first. So before talking about the group, I think it's important to look at different content of the diet that we used. It's important to note that this chow and high-fat sucrose diet were the same one that we used previously in my PhD project that I talked about. The content of the chow diet, normal chow diet, is 4% of saccharose and 5% of fat, compared to high-fat sucrose diet, where 50% of its content composed of saccharose and 20% of fat. By that, we divided the Sprague-Dowdy rats, the same age, into two groups. The first one consuming the normal chow diet that I talked about before. The other group, they will consume a high-fat, high-sucrose diet. This group will be divided into similar 3 groups. These groups, the first one will consume high-fat sucrose diet and perform no type of exercise, will have a sedentary life. The other group will consume a high-fat, high-sucrose diet and perform aerobic exercise for 12 weeks. And these rats were taken from Rios ATL paper. The other group will be rats consuming a high-fat, high-sucrose diet and performing resistance exercise for also 12 weeks. So this is, I'll go into more details in the information about the exercise training. So rats performed aerobic training. The training is a progressive treadmill running, where performed 5 days per week for 30 minutes, reaching a speed of 25 meters per minute. I hope that video works. Yes. So this is an example of a rat performing the treadmill training. So the exercise intensity and duration were progressively increased over the first 4 weeks, then maintained at 25 meters per minute for 8 weeks. So the total exercise duration were 12 weeks. The second type of exercise was the resistance exercise. It composed of a ladder climbing exercise program performed 3 days per week. Rats were trained to climb a 1 meter almost vertical ladder with weight suspended from the base of their tails. So this is a video showing rats performing the resistance exercise. So the initial load for each animal was 50% of the body mass. After each successful ladder climbing, rats were given a 2-minute rest period, and then load was increased by 30 grams. This was repeated until the rats were unable to complete the ladder climbing. So the primary outcomes of this study were joint integrity. We looked at changes in cartilage, bone, meniscus, and other parts of the joints. We also assessed body composition using DEXA machine. Specifically, we looked at changes in body mass and percentage of body fat. We also looked at changes in lipid profile, which is total cholesterol, HDL cholesterol, and triglycerides at the end of the intervention. So for the knee joints, joints were collected, decalcified, and cut using microtome with a 10-micron sagittal sections. These sections were stained using 3 different stains to stain the bone, the nucleus of the chondrocytes and the cartilage, specifically the protoglycan in the cartilage. All slides were reviewed and then scored using modified Mankin and RC scoring system. So this is how the joint looked at the end, where we can compare the joint damage between different groups. For the results, we looked at changes in body, I think it's good to go to joint integrity first. So looking at the joint integrity, we compared, this is a box plot with the median and interquartile range for the 4 groups. So we found that rats consuming a high-fat sucrose diet without any kind of intervention had a significantly higher knee joint score, which means more joint damage compared to the chow sedentary animals. We couldn't find any difference in joint score between rats performing aerobic exercise, resistant exercise compared to chow sedentary animals. This may indicate that resistance and aerobic exercise both had a beneficial effect protecting the joint from the bad effect of the high-fat sucrose diet. However, the interesting result that we show here is that there was significant difference between joint score between aerobic exercise and resistant exercise, where resistant exercise had higher joint score, which means rats performing resistant exercise had more joint damage compared to aerobic exercise. Going back to the body composition, this table shows the final body mass and percentage of body fat at the end of the intervention, represented mean and standard deviation. So we couldn't find any significant difference between body mass between the 4 groups. These results indicate that we cannot relate the joint damage that we saw to increase in mechanical stress in knee joints. So this suggests that there is another mechanism that associates obesity with joint damage and starting or onset of progression of knee osteoarthritis. We also found that rats performing resistance exercise and rats consuming a high-fat sucrose diet without any type of intervention had significantly higher percentage of body fat compared to chow. So as you can see, even though these both exercises were done for 12 weeks, the resistant exercise, the percentage of body fat in rats performing resistant exercise were significantly higher. Going back to the lipid profile, so this table represents the biomarkers or lipid profile, where we assess total cholesterol in serum. These values are taken from serum. So total cholesterol, triglyceride, HDL, and ratio of triglyceride to HDL. I know that there are lots of numbers in this table, so my main focus on this, or what I wanted you to see in this table, that all lipid profile biomarkers were significantly higher in the high-fat sucrose diet or high-fat sucrose group compared to chow sedentary group. This may explain the difference in joint score that we saw previously in joint integrity. So going to aerobic and resistance exercise, we found that aerobic exercise has significantly lower serum triglyceride level compared to the high-fat sucrose group. We also found that performing resistance exercise had higher ratio of triglyceride to HDL. This is represented in this box plot, but as you can see, this is the y-axis represents triglyceride to HDL ratio, and the x-axis represents the 4 different groups. We found that rat consuming high-fat sucrose diet and performing resistance exercise has significantly higher triglyceride to HDL ratio compared to aerobic exercise and to chow sedentary. We think that this may explain the difference in joint score between aerobic and resistance exercise. For the discussion, the result that we got showed that high-fat sucrose diet without any type of training significantly increased knee joint damage and increased lipid serum biomarkers. Both aerobic and resistance exercise prevented the knee joint damage associated with consuming a high-fat sucrose diet. It is unlikely that difference in knee joint damage could be explained by increase in body mass, because we didn't find any difference in body mass between the 4 groups. So there should be another mechanism that links obesity to joint damage. We think also that lower level of triglyceride in the aerobic group and high level of serum triglyceride to HDL ratio in the resistance group explain the difference between knee joint between the aerobic and resistance exercise. For the limitation of the study, the frequency and duration of the resistance training was not the same as aerobic training. So we should be very careful when saying that aerobic exercise had more beneficial effect or may protect the joints more, because the dosage were different. So to be more specific, we should say that this dose of aerobic exercise showed a better or was more beneficial to the joint compared to this dose of resistance exercise. And unfortunately, we don't have data about pro-inflammatory biomarkers in synovial fluid and even in the serum. We think that if we have this data, it will give us a good indication or an insight on why do we see differences in Mankin score between groups. In conclusion, aerobic and resistant exercise successfully reduced knee joint damage in the animal model of a high-fat sucrose diet-induced obesity, metabolic syndrome, and knee joint osteoarthritis. This dose of aerobic exercise possibly exerting a greater or a better protective effect than the resistance exercise. By that, I'll finish the second part of my presentation. I would like to thank everyone in her group, especially Ruth, for all the help and support she gave me, and I'll be happy to take any questions. Thank you.
Thank you, Nada. So if you could now unshare, yes, thank you very much. I also would like to kindly suggest everyone to turn on your camera if you okay with it. I think it'll give us better and more active discussion period. Thanks for doing it. So if you have any questions for our speaker, Nada, please use the icon raise hand button that's found if you go click reaction icon at the bottom of your Zoom screen. Now the floor is open for the question. Yes, Michael, please go ahead.
Hi, Nada. Thanks for the interesting talk. I really liked it. I'm intrigued by the last point, and I wonder if you have any insights into whether there's something about aerobic exercise, like if you could ensure that the exercise doses were equivalent between the 2 groups, like the stimulus for the resistance training and the aerobic group, do you think you would see the same result? Is there something that's inherently different about one of the type of exercise that would lead one to be more beneficial than the other?
Well, I think I don't have enough data to support what I'm saying, but I would speculate that the mechanism each exercise works is different. So aerobic exercise will increase the cardiovascular ability, and more oxygen will be supplied to the tissue compared to resistance exercise, where it will strengthen the muscle. So one paper suggested that increased inflammation in obesity is associated with hypoxia, which less oxygen supplied to adipose tissue. So we think that maybe aerobic exercise will supply more oxygen to these tissue as a result, it will decrease the inflammation. But as I said, like we don't have enough data to support that. I also think that the amount of the exercise, like the resistant exercise was designed to mimic what is recommended for a human resistance exercise. Same thing for the aerobic exercise. So this is what is recommended for a human to perform, like 5 days a week of aerobic exercise and 3 days a week, half an hour of resistance exercise. So maybe if we increase the resistance exercise, it will have more a detrimental effect rather than a good beneficial effect. But as I said, this is all speculation, just based on what we have.
Cool. Thanks for your thoughts.
Thank you.
Let me also ask you a question, Nada. So, I mean, you kind of answer the question that I already have while you're answering to Michael. So if you then combine like aerobic and resistance training, which is usually recommended as a also good exercise strategy, would you expect better results or better for health? Do you have any feelings about combining the two types of intervention for your Reds?
Well, this is a great question, Sungwon, because we already have a group that performed both resistance and aerobic exercise. And based on previous studies, like combination of these two exercises show beneficial effect in terms of muscle strength and decreased body mass and body weight, percentage of body fat. So we have this group, but we still did not analyze their lipid profiles and all these other factors. So I think that it will have more better beneficial effect, but like, I don't know exactly. We'll have to look at the data to be able to decide if that's really what's going to happen.
Also related to your first part of study where you, of course, you are now working on your project, but you mentioned that you are giving now different time window, applying different like 3 weeks, 6 weeks, and 9 weeks, was it? For the intervention after you feed the Reds with high fat, high sucrose diet. So you are differentiated 3 timing. I'm just curious, would there be any comparable duration for humans? So like 3 weeks for Reds is equal to like 3 years for humans, so that I can have a feeling that, okay, I can eat something high fat, high sucrose diet for 3 years at least.
Yeah, I think comparing the years for human rat is not very applicable. So this is why we're looking at different biomarkers, changes in biomarkers, pro-inflammatory cytokines, and synovial fluid changes. We also like to look at gut changes in gut microbiota. So these markers will help us decide, like, if we see these biomarkers in human, this means that OA has been already progressed and like there is a problem. But if we didn't see it, this means that the joint may be healthy. So relating the age, I don't think this will be very applicable, but relating biomarkers, different gut microbiota community will be more beneficial and reliable.
And the last question that I also had is that, so you said you are using 3 weeks of Reds in order to start the intervention for your first part of the study. Am I right?
So sorry, can you repeat that?
12 weeks of the Reds, that's the one that you start the intervention?
Yes.
Do you know how old the Reds compares to the humans? So like a 12 weeks of Reds is it like a adolescence duration, or? So
we chose 12 weeks old rat because like we can say that rats would reach skeletal maturity at 12 weeks compared to human, where they would reach skeletal maturity, I think around 20 years or maybe less or more. So this is why we chose like exactly the 12 weeks to try to eliminate the internal healing in the cartilage due to consuming the high fat sucrose diet.
Thank you. I see Sarah, you have a question for Nada?
Yeah, I just have a quick question regarding like the first part. I just wanted to clarify. So when we have like the leaky gut syndrome, it's not just a weakening of the tight junctions, but also like degradation of the mucus layer?
Yes, because the mucus layer is supposed to separate the gut microbiota from the epithelial cells and all their byproducts. So when these mucus layer is less, it has the gut microbiota had a direct interaction with the epithelial cells. And as I said, that in a healthy human or a healthy host, there is good and bad bacteria at the same time. So even if there was not a great dysbiosis, removing this mucus membrane would allow the bad bacteria to interact with the epithelial cells directly.
Oh, okay, thank you.
I see. Michael, you have a question for Nada?
Yeah, I just thought of something at the beginning. In the first couple slides, I think when you were going over Jacqueline's findings, you said that exercise tends to accelerate NEOA development when it started 12 weeks, I think, after the induction of the high-fat diet. And in humans, I don't hear the same thing. Like it seems always, oh, you should exercise even if you have NEOA because exercise doesn't progress NEOA. So I'm wondering if there's just something different in the rat model or if the timelines are just different that these are occurring on.
So what we saw in Jacqueline's study is that after introducing these interventions after 12 weeks of starting the high-fat sucrose diet, they couldn't prevent or even slow the progression of NEOA. This may be because the OA has already progressed and reached a level that it is unreversible. So in this case, we think like when the cartilage is completely degraded and there is an interact between the two bones, intense exercise will be very painful. Even I think for a human, it will be very painful for them. So it won't be easy to perform exercise. But I know that exercise, especially low intensity exercise, is advised for patients with OA. Of course, at different level with the different stages of OA, because maybe it's not working on the cartilage itself, but it's strengthening the surrounding muscle, which also, and decrease the body weight, which also play a role in OA progression.
Okay, cool, thank you. That makes sense that it might have to do with the stage of the disease that you start at. Thank you.
I see, Rob, you have a question for Nada?
Yes, I do. Nada, the high-fat, high-sucrose diet, if we say that we're considering that to be a sort of a poisonous diet, does it have a dose-response curve? So if you eat a lot of high-fat, high-sucrose food, are you going to have worse OA? And which raises the question, in the aerobic group versus the resistance group, did you measure simply how much food they ate and were there any differences in these? It's the volume of high-fat, high-sucrose food you ate.
Like for the aerobic and resistance exercise, I think that was done. The point is these studies were done at different time points. So my part was to collect the joints and score them. But for my study, for example, when I compared rats consuming a high-fat sucrose diet and rats consuming a chow normal diet, we tracked their food intake 3 or 4 times during the whole intervention period. And so that there was no difference in the amount of food consumed. So on average, the high-fat animal consumed 28 grams of food a day compared to the chow, which also consumed around 27 point something. So there was no significant difference in the amount of food. However, the calories that contained in the diet were different. So the
What about the high-fat, high-sucrose diet? So it's the same type of food, but the aerobic exercise group and the resistance exercise group, because you've got 2 different exercises, but have you got the same volume of that food, or does one of them make them much hungrier? I think, and therefore they eat more of it, bad food.
Yeah, I see what you're saying. Like, I think we have the data for that, but I did not look at it. Like, I have to take it from Jacqueline and from Kevin both because they performed the exercise, but I'm sure we do have the data for that. I think it will be interesting to look at the amount of food consumed and the difference between the types of exercise. So this is, I think this is doable and can be added.
Yeah, thank you.
I see, Walter, you have a question for Nada?
Yeah, thank you, Nada, for a nice talk. I enjoyed that as well. I have a couple of questions. You know, in the first study, when the first study that Jacqueline did, you know, she found that the knee joint degeneration was prevented with the fiber intervention and with the aerobic exercise. Do you think the pathways of how that was prevented are the same? Or do you think there might be very distinctly different mechanisms at play when you eat, you know, lots of oligofructose or when you do aerobic exercise?
Well, I think there should be like a joint mechanism between them, but it doesn't have to be all the mechanisms. So I think both exercise and fiber will decrease the systemic inflammation, maybe decrease the amount of pro-inflammatory cytokines produced by the adipocytes. However, the exercise, like in her study, she showed that exercise did not change the gut microbiota, the dysbiosis in gut microbiota. So maybe exercise and fiber, they have different mechanisms that will meet at a specific point, which at the end decrease the systemic inflammation.
So the common denominator would be, if whatever you do, you get the chronic inflammation under control, then you might be better off.
I think, yes.
Okay, good. The second question that I had is, you know, you showed us the first part of your study there and had some really interesting results, but you haven't analyzed yet the joints. Yes. And I would like you to, what are you speculating that you're going to see? What do you think you will see, knowing that you have not really looked at them yet, but what's your expectation?
Like, so far we have 36 joints, 18 of them has been scored. So me and Ruth are working on the next 18. So hopefully we'll have a result very soon. But according to what I saw from the previous paper, I would expect like the fiber and exercise, when we do the exercise, to have a beneficial effect, maybe protect the joints from the degeneration. Although the obesity has been induced after 3 weeks of starting the high-fat sucrose diet, but I don't think the systemic inflammation has been completely established in this time point, because after 2 weeks of starting the high-fat sucrose diet, we couldn't detect a significant difference in body mass, in body mass. But after 3 weeks, we saw that. So my speculation, if we say that inflammation is the main source, different sources of inflammation are the main source of developing OA, I don't think 1 week will have this determinal effect that can't be reversed. But this is all speculation. I think.
Yeah, but the idea being that the 3-week delay was not long enough to induce changes that become irreversible. So you think you'd still rescue the joint with the fiber and the exercise. Okay, good.
This is my speculation, yeah.
Yeah, good. Yeah, I'd like to speculate a bit. Regarding your second study, the second one that you mentioned in your presentation today, there is 2 things that I found a bit funny. And the first one is that the chow animals and the high-fat sucrose animals, at least statistically speaking, have the same body mass, whereas in the first study, that was clearly not the case. Do you have an explanation why in one study you get the one result and in the second study you get another result? Do you have any explanation for that? Or?
Well, actually, I was a little bit surprised when I compared the body mass in the second study. However, when I went back to literature, it seems that exercise may reduce the inflammation regardless of decreasing body mass. So many studies reported that there was no difference in body mass even after a long period of exercise, while other studies reported that there is a difference. I think the duration of, like for Jacqueline, she did the same type of exercise, aerobic exercise, and same duration, but some rats may be obesity prone, which will gain lots of weight after 12 weeks, and maybe some rats will be obesity resistant. They will develop obesity, but not as much as the prone. So on average, the mean won't be significant, but I think it will be interesting to look at individual data points, see how many rats had a very high or a significant difference in their body mass compared to how many rats were gain weight, but not that much compared to chow.
Yeah. It just seemed to me that in your chow group there, in the second study that you looked at, you have a fairly large variation, and I was wondering if that variation was bigger than what Kelsey or Jacqueline or Kevin had found in their previous studies, and that might have, from a statistical point of view, mucked up, you know, your results in a sense, because we would expect in the high-fat sucrose diet that the animals not only would they have higher body fat percentage, but also that they would be that they would be heavier. The other thing that I thought was a little interesting was, and I wondered if you had any explanation for that, was that in the high-fat sucrose and resistant trained animals, the triglyceride to HDL ratio was bigger than in all other groups, including the high-fat sucrose group. That kind of would suggest that resistance training, at least from that parameter point of view, is not really a good thing to do. Do you have any explanation potentially why you might have that result?
Honestly, I don't, but I think we should, when we look at the ratio between triglyceride and HDL, we should be looking at both of them. We're looking at triglyceride and we're looking at HDL too. So in the high fat sucrose, we had a significant increase in HDL, similar to, but we didn't see that increase in aerobic exercise. So I think difference in HDL ratio and triglyceride ratio will, different in HDL level and triglyceride level will play a role in the final ratio of triglyceride to HDL ratio.
Okay, good. Thank you.
Art, please go ahead.
I was also interested in the result that you didn't see higher body fat with the high fat sucrose condition. And I'm just wondering where you think basically the calories have to go somewhere. So where did they go? So, you know, so I guess I could imagine that those rats might have just done more, what they call, what is it, NEAT? What does NEAT stand for again? So they're burning calories without, you know, being able to run on the wheel, but they're still able to burn calories in other activities. Or another possibility is that maybe they're not digesting the food as well, so maybe they're pooping out the calories, or, you know, so basically the question is, where do you think the calories went?
Actually, we found a significant difference in percentage of body fat in the high fat sucrose compared to chow.
But with the exercise, there wasn't a difference, right? So the exercise group was supposedly burning more calories, but then not reflecting in the body mass, right?
You mean the aerobic exercise?
Oh, yeah.
Yeah. So I actually don't know, but like maybe the aerobic exercise will, I'm not sure. I don't know where would the calories go if there is no increase in body mass, but there is a significant increase in body fat. Maybe this will go to a difference in lean body mass at the end. So the overall body mass will be the same, but lean mass will be less compared to fat. I'm not sure if this will answer your question, but like I think the direct answer for that, I don't know.
Well, the reason I ask is, I mean, I think this is probably an old-fashioned question, but yeah, maybe about 10 years ago, I think there was more interest in NEAT, which, come to think of it, I think I know what it stands for, non-exercise activity thermogenesis, which was basically people are trying to understand why you could have people who are having very, very different amounts of exercise, but then they might you know, have very similar body fat. And then the idea was just that your body might find other ways to burn calories. And so, you know, I don't know anything about this field, but one thing that makes this interesting for rats is that I could conceive of measuring things that aren't as easy to measure with humans. So like the way they would measure NEAT in humans was always with activity monitors, which provide you very limited information, but you can monitor rats 24 hours a day, and then you could use video analysis and things like that. And so I imagine you could have a much better idea of what they're doing, or you could even measure their oxygen consumption in their living quarters, which is much harder to do with humans. So I'm just wondering if there are ways or you know, potential to get at this NEAT question, or maybe NEAT is no longer the cool question of the day.
Yeah, I think this is like an interesting way to look at it, and yeah, I agree with you. It will be interesting to see if they perform exercise but they did not gain weight, where did this calorie go? So I agree with you. Yeah.
Yes, Walter, please go ahead. Sorry, you are.
One of the questions that I also had, it's more a generic question, but it relates to your model. And it goes back to your introduction where you said, well, you know, obesity is maybe not due to weight, because people with obesity and metabolic syndrome also have a lot of osteoarthritis in the finger joints, and they're not really loaded. One of the interesting observations with previous studies on this model was that the knee joint is affected, but it seems with the high-fat sucrose diet, the hip joint is not affected. And so I find it sometimes difficult to make a systemic argument. Well, we have inflammation, so that's bad, and so the joints get inflamed, and therefore we get osteoarthritis. And that seems to be true for the knee that you looked at, and it seems to be true for previous studies for the shoulder as well, but not for the hip. And I was wondering if you potentially had an explanation, or how you might think about that. Why the knee, but maybe why not the hip when we give this bad diet to the rats?
Yeah, I agree. This is a very interesting question that I thought about. If we consider that the systemic inflammation that runs in the whole body is the main cause of OA, why do we see it in specific joints, not the others? Like, I would think about it as that we have to look at also local inflammation in the joints. So maybe one joint will be affected by this systemic inflammation more than the other. But of course, this needs to be done like with the same duration, like with the testing the synovial fluid from the joints at same points, at same time points, and looking at the same biomarkers, inflammatory biomarkers.
So if that was the case, how do you think that would work, that one joint might be better protected from local inflammation than another? I know that Dr. Hart has always argued that there's a relationship between inflammation and eye diseases, but that the eye has a fabulous protection mechanism for inflammation. And so your joints and muscles and tendons go first, and only then do the eyes get attacked, because somehow they are better able to take care of like a systemic inflammation. So you think something similar might be happening in different joints of the body?
Maybe. And another thing that I would think about is like the onset of OA could be in a joint, could be started by different things. Like some joints had a trauma, or there is a degradation in the cartilage. Other joints will develop OA because there is a problem in the subcondylar bone. Other joints will develop OA because there is an inflammation in the synovium. So at the end, they will develop OA, but the pathway that they started with is different. So maybe this systemic inflammation will affect different type of the joint in different joints differently. For example, like it will have more effect in synovium and subcondylar bone in the joint compared to the hip or the shoulder. This is also a speculation. Like, I think we need to do more research to know exactly why.
No, we are speculating here. Yeah, we're speculating here. Good, thank you.
Would there be any last question for Nada? If not, I would like to thank Nada again for giving an interesting talk. Next week, we'll be hearing from Dr. Ryan Schroeder, and he'll be talking about passive loss and active cost in the spring mass model of running. I hope you have a wonderful weekend, and I'll see you all next week.